Hello everyone, my name is Sanjana Kanochia along with my group members Fatima, Khushi and Ramya. We are presenting our topic Vaccination for Healthcare Providers, a Quality Improvement Initiative. Now I'll talk about the rationale for selecting this topic. We chose to focus on increasing vaccination rates among healthcare providers because they are at higher risk of exposure to infectious disease such as influenza and COVID-19. Vaccination protects not only healthcare workers themselves but also vulnerable patients, particularly whose immune system are weakened. Immunization strengthens infection prevention and control within a healthcare setting. When vaccination rates are low, outbreaks can occur and compromising patient care and the functioning of the healthcare facilities. Addressing these issues is really essential to improve the overall patient safety and quality of care. Canadian quality and safety issue. In Canada, vaccination uptake among healthcare workers remains inconsistent. Public Health Ontario has reported gaps in staff immunization, which increases risk for patients, healthcare providers, and the healthcare system altogether. This is both a public health and ethical concern as healthcare providers have a responsibility to protect patients from preventable infections. Enhancing vaccination rate is crucial to reduce healthcare associated infection and ensure a safe and high quality environment.
In this slide, I'm going to talk about proposed solutions that we can use. As nurse leaders, we can improve vaccination uptake through several strategies. Education programs will help address misinformation and increase staff knowledge. Providing on site vaccination clinics will improve accessibility. Leadership support and clear policies will promote accountability, while reminders and incentives can encourage higher staff participation. In this slide, I'm going to discuss about the expected outcomes. The expected outcome is a significant increase in vaccination rates, for instance, from 60% to 90%. This increase will help reduce the transmission of infections within the healthcare settings and protect both the patient and the staff. As a result, patient outcomes will improve through safer care and reduced complications. Overall, these interventions will contribute to a safer, healthier, and more supportive work environment. Moving further, I'm going to discuss about evaluation methods. We will evaluate the effectiveness of these interventions using both qualitative and quantitative data. Quantitative measures include vaccination rates, infection rates, staff absenteeism, and participation in programs. However, qualitative data will include staff feedback, perceptions of safety, and changes in knowledge and attitudes. This will help ensure the interventions are effective and support continuous improvement.
Hello everyone, my name is Fatima Patel and I will continue further. While promoting vaccination among healthcare providers is important, there are several barriers that can make this challenging. One major barrier is vaccine hesitancy. Some healthcare workers may have concern about vaccine safety, side effects, or effectiveness, even though vaccines are evidence based and widely recommended. Another barrier is a lack of knowledge or misinformation. Not all staff may fully understand how vaccine works or why they are so important in preventing the spread of infection. Third is time constraint are also a big issue. Healthcare providers often have busy schedules, long shifts, and may not find time to get vaccinated. To address these barriers, we can implement several solutions. First is education session can help provide accurate evidence-based information and increase confidence in vaccines. Second, we can address common myths and misconceptions directly, creating a safe space for staff to ask questions. Lastly, offering flexible vaccination schedules such as mobile clinics or extended hours can make it easier for staff to access vaccines without disrupting their work. This quality improvement initiative has a positive impact on multiple levels: staff, patients, and healthcare leadership. For staff, increased vaccination leads to greater personal safety and reduces the risk of illness. This also means fewer sick days and better overall well-being. For patients, especially vulnerable populations such as older adults or those with weak immune system, higher vaccination rate among healthcare providers significantly reduce the risk of infection. From a leadership perspective, this initiative strengthens the overall quality of care. It helps build a strong culture of safety and accountability where protecting patients becomes a shared responsibility among healthcare team. To ensure that this initiative is successful in the long term, we develop a 5 year sustainability plan. In year one, the focus will be on implementation. This includes staff training, launching education programs, and setting up vaccination clinic. During year two and three, we will focus on monitoring progress and making improvements. In year four and five, the goal is to integrate these practices into organizational policies. Vaccination programs will become a routine part of workplace. This step by step approach helps ensure that the initiative is not just a short term effort but sustainable and lasting improvement in healthcare practice. Thank you.
Leadership style. Transformational leadership involves leading by example, where nurse leaders act as role model by getting themselves a vaccination first. It inspires a shared vision for patient safety and vaccine compliance. Addresses the vaccine hesitancy by educational strategies and engagement initiatives. It promotes evidence based practice by ensuring that vaccination policies are guided by research and team collaboration. According to Guama, leadership style improves the nursing practice, while Health Canada highlighted its role in strengthening engagement and safe care delivery. Rogers' diffusion of innovation theory. This theory explained how new practices such as vaccination uptake strategies spread among the healthcare workers over time. In this project, vaccination uptake is promoted through early adopters who influence other healthcare workers. Education, peer role modeling, and visible benefit help to reduce the hesitancy and support the gradual acceptance of vaccination. This leads to sustained behavior change and improved patient safety in healthcare settings. Resources required to maintain the vaccine compliance among the healthcare workers are human resources, which include nurse leaders, infection control teams, staff for vaccine administration. Organizational support include policy support and leadership commitment. Financial resources are the funding for the vaccine and clinic operation, budget for educational campaign and training. Technological resources are electronic tracking system and tools required for monitoring the outcomes. Conclusion. Vaccination of healthcare providers is critical for patient safety. Nurse leaders play a vital role in evidence-based change, and structured quality improvement initiative leads to reduce infection transmission and improve the healthcare outcome. The final insight is that the sustained success depends on strong leadership, staff engagement, and continuous evaluation. These are the references.